Nurse Aide Practice Exam Credentia. Question 1. When assisting a client with a bath, the nurse aide should: Option A. Bathe the client from cleanest to dirtiest areas. Option B. Bathe from the feet up. Option C. Wash the perineal area first. Option D. Use one washcloth for the entire body. The correct answer is option A. Bathe the client from cleanest to dirtiest areas. Bathing from cleanest to dirtiest, face first, then upper body, abdomen, arms, legs, and perineal area last, prevents spreading microorganisms. Using one washcloth for the entire body is unsanitary. Question 2. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include: before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 3. A client is having a seizure. The nurse aide should: Option A. Put a spoon in the client's mouth. Option B. Hold the client down to stop the seizure. Option C. Clear the area and turn the client to their side. Option D. Leave the client alone. The correct answer is option C. Clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration, and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 4. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 5. After giving a client a back rub, the nurse aide should always note: Option A. The last time the client had a back rub. Option B. Any change in the client's skin. Option C. The client's weight. Option D. The amount of lotion used. The correct answer is option B. Any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 6. The pulse deficit refers to the difference between: Option A. Apical and radial pulses. Option B. Systolic and diastolic pressure. Option C. Radial and carotid pulses. Option D. Brachial and femoral pulses. The correct answer is option A. Apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 7. A client with mental health issues is refusing medication. The nurse aide should: Option A. Force the client to take the medication. Option B. Report the refusal to the nurse. Option C. Hide the medication in food. Option D. Tell the client they will get worse. The correct answer is option B. Report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 8. The nurse aide should document care. Option A. At the end of the shift. Option B. As soon as it is completed. Option C. Before providing care. Option D. Only if the client's condition changes. The correct answer is option B. As soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 9. When giving a bed bath, water temperature should be approximately: Option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns. Question 10. When a client expresses a spiritual or religious concern, the nurse aide should: Option A, offer to contact the hospital chaplain or the client's clergy. Option B, provide personal spiritual advice. Option C, tell the client to pray about it. Option D, change the subject. The correct answer is option A, offer to contact the hospital chaplain or the client's clergy. The nurse aide should support the client's spiritual needs by offering to contact a chaplain or clergy. Personal spiritual advice is outside the scope of practice. Dismissing spiritual concerns ignores holistic care. Question 11. When assisting with meals, the nurse aide should: Option A, place the food tray on the bed. Option B, place the food tray within easy reach on the overbed table. Option C, feed the client immediately. Option D, leave the tray for the client to manage. The correct answer is option B, place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 12. A client at risk for pressure ulcers should be repositioned how often? Option A, every hour. Option B, every 2 hours. Option C, every 4 hours. Option D, once a shift. The correct answer is option B, every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 13. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A, talk to the client regardless of response. Option B, sit quietly with the client. Option C, leave the client alone. Option D, ask personal questions. The correct answer is option B, sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 14. The family of a dying client is upset. The nurse aide should: Option A, ask the family to leave. Option B, offer support and a private place to talk. Option C, ignore the family. Option D, tell the family everything will be fine. The correct answer is option B, offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 15. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 16. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 17. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A, roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 18. The best way to communicate with an unresponsive client is to: Option A, avoid talking to them since they can't hear. Option B, speak to them as if they can hear and respond. Option C, speak loudly near their ears. Option D, only speak to family members. The correct answer is option B, speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 19. A client has difficulty adjusting to a new facility. The nurse aide should: Option A, tell the client they will adjust. Option B, allow the client to express their feelings. Option C, leave the client alone to adjust. Option D, call the family immediately. The correct answer is option B, allow the client to express their feelings. Allowing expression of feelings helps the client process the transition. Telling them they will adjust, A, is dismissive. Leaving them alone, C, may increase isolation. Calling the family, D, may be appropriate but not the first step. Question 20. When measuring intake and output, INO, the nurse aide should record: Option A, only water the client drinks. Option B, all fluids consumed, including ice chips, soup, and gelatin. Option C, only oral fluids. Option D, only 4 fluids. The correct answer is option B, all fluids consumed, including ice chips, soup, and gelatin. Intake includes all liquids and foods that become liquid at room temperature, such as ice chips, soup, broth, gelatin, juice, milk, and water. Recording only water or oral fluids misses significant fluid sources. Question 21. To prevent skin breakdown, the nurse aide should: Option A, keep the skin clean and dry. Option B, keep the skin moist with lotion. Option C, rub bony prominences vigorously. Option D, use only powder on the skin. The correct answer is option A, keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 22. When assisting a client to walk, the nurse aide should walk: Option A, behind the client. Option B, next to and slightly behind the client, holding the gait belt. Option C, in front of the client. Option D, far to the side of the client. The correct answer is option B, next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 23. What factor is not known to affect vital signs? Option A, pain. Option B, age. Option C, hair color. Option D, exercise. The correct answer is option C, hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 24. What does the abbreviation ADL mean? Option A, ad lib. Option B, as doctor likes. Option C, activities of daily living. Option D, after daylight. The correct answer is option C, activities of daily living. ADL stands for activities of daily living, which include bathing, dressing, toileting, eating, and mobility. This is a fundamental concept in nurse aide practice. The other options are incorrect medical abbreviations. Question 25. When a client dies, the nurse aide should: Option A, leave the room immediately. Option B, provide post-mortem care. Option C, call the family. Option D, remove all personal belongings. The correct answer is option B, provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully.